Hello, I'm Dave Nichols. On July 2nd, I come down with Bell's palsy. I was at a church function, and at that function we realized we had a problem. At that point I was taken to the ER, and the ER doctor said that I had Bell's palsy. At that time, the doctor at the ER, he prescribed me a high-powered or high dose of steroids, as well as Advil. And the following morning, I had a lot of trouble in that my high blood caused a high blood pressure situation for me. I became very ill, very sick. And then I came to Dr. Chris on July 4th, and he looked at the two medicines and said those two medicines would not work together. And at that time, I realized that I had a problem not to use the two medicines together at that time. Dr. Chris on July 4th had talked to me about the CRT, the cranial work that needed to take place with the palsy that I had. As soon as he done that for me, I realized then I had tremendous neck movement. Also, I realized that the pressure had been released a little bit on that side where the palsy had taken place. The first week after the cranial work, the CRT, I seen visible signs of differences. You know, at that point, prior to this, I actually had a palsy pulling my face down. My eye was larger. I could not blink the left eye at all. I had no movement in this side of my face. When I would drink, I would leak water. There was a lot of bad things happen. But after the first week, you could actually see a visible sign, a difference of an improvement, a facial improvement. By the second week, I had some movement. I began to move just a little bit in this area here, but I began to also feel pain at that point because I guess the nerves at that point were beginning to fire off again and began to work a little bit. By the third week, I had a lot of movement. Let me go back to the second week. The second week, I did have some blinking take place, but it was very difficult. By the third week, I had blinking, had a lot of facial movement, was just astonished at how quickly it had come around. By the fourth week, you couldn't even hardly tell that I've even had the Bell's palsy. The only thing that I see that I have a problem with now is if I'm under a lot of stress or if real tired, then sometimes I'll begin to draw again. But usually right after the cranial work, that'll get me straightened back up. I'm impressed. I can't even imagine not having Dr. Chris help me with this. I've been online. I've looked at people online that have had this problem, and I've seen 3 to 6 months before they've seen any improvement. Here I am, just a few weeks later, and I'm almost 100%, fixed. So I appreciate him so much for what he's done for me. And I highly recommend this. In fact, I would prefer the cranial work over any of the other work that we've done in the past. So I appreciate what Dr. Chris has done for me. Thank you.